Thank you for taking the time to talk to me today, Su Shan. So, if you could please introduce yourself, talk a little bit about maybe your clinical practice, your background, and your research.
Okay. My specialty is in TCM Gynecology and Obstetrics, and I have been practiced TCM for more than 20 years. And I have lots of patients. They come to me because of women's problems.
A lot of women complain of premenstrual tension, discomfort, maybe lower back pain and cramping coming up to their period. What would you consider this to be a sign of?
Oh yes, that's many women they suffer from premenstrual symptoms, and it's because of unsmoothly going of the qi and blood. If the qi goes unsmoothly, they have painful breasts or painful abdomen, or they have swelling before periods. And if their circulation is not good, it's in Chinese medicine language, we will say it's blood stasis or qi stagnation. If they have these two patterns, they would have premenstrual symptoms, premenstrual distress a lot.
And then how does Chinese medicine help with that?
Actually, Chinese medicine can help qi and blood go smoothly, goes faster, and if the qi goes faster and blood goes faster, they have a smooth menstruation, and all the symptoms before period will gone.
But of course, they can also go too fast, and then we get things like excessive bleeding or a cycle that lasts, a bleed that lasts too long.
Yeah.
So how is this corrected then?
If the qi and blood goes too fast, yes, too fast, they will have heavy menstruation or a prolonged menstruation. That means qi and blood goes too fast, or the heat goes up. If the heat goes up and produce symptoms, and we will spread the qi, spread the heat, and make it the qi and blood goes smoothly, but in a neutral position, neutral condition.
Yes, so bring it back into balance.
Yes, the balance is important.
Mm-hmm. And in terms of Western medicine, things like premenstrual tension, their causes are not very well known. It's understood that there is a relationship with hormones, but the Chinese medicine model, how is it different from the model of hormones in terms of the menstrual cycle?
So in Western medicine, they think premenstrual symptoms are from the effects of progesterone. If they have high progesterone, or the levels of progesterone change a lot before periods, they have the woman will have more severe premenstrual syndromes. That's the theory of Western medicine. But in Chinese medicine, we think it's all the symptoms comes from the smoothly going, not the qi and blood is not smoothly going during that period of time, because in physiologically during the premenstrual period of time, during that week, 1 week or 2 weeks, that few days, the woman's body will have more fluid and more stagnation of the qi and blood. So the more fluid and more stagnation of qi and blood will cause all the symptoms. The Chinese medicine theory, we do not talk about hormones. We talk about qi and blood.
Because the concept is before bleeding, the body, the uterus fills with blood.
Yes, that's
obviously.
right.
So the blood in the body needs to be sufficient, the fluid needs to be sufficient, and then once it is full, your body needs, and this is the blood, and then once it is full, your body needs to have enough strength to then discharge.
Yes.
And then this is the qi. Would you agree with that?
Yes, that's right. Before the period, and when the period needs to goes out, the blood needs to goes out, they need power to do that. And the power comes from qi. And if the power is sufficient, the blood will go out smoothly, if the power is not sufficient or they stagnate in one place of the body, one location of the body, they will cause symptoms. For example, if the power is strong but the power doesn't go smoothly, the power stagnate in the head, they will cause premenstrual headache. So that's how the symptom comes.
And when I am treating, I think it is very interesting that Chinese medicine pays attention to a lot of the different aspects of a cycle.
Yes.
So it is not just painful or not painful. It is, regularity, duration of the bleed, if the bleed is too heavy, too light, clots, and other symptoms that manifest.
Yes, lots of conditions for women. For different people, different women have different problems. Little menstruation, heavy menstruation, obviously the patterns are different. The conditions are different. So we need to focus on one condition and differentiate the patterns. If we can differentiate the pattern, and we will know what the condition the body is, and we will treat the condition.
And of course, the menstrual cycle is a cycle. There's different, the patient will present differently at different points in the cycle. So in your clinic, Dr. Su, do you adjust treatment based on what part of the cycle your patient is in?
Yes, that's right. Yeah, it's a good idea, and that's a theory. Also, we practice like that. And let me explain that. So during the period, the bleeding time, the purpose is to expel the blood. So we use herbal medicine like dangui to expel the blood. So we call it activate the blood. Activate the blood.
Yes, move it more strongly.
Yes, that's right. And after period, when the period stop, and the endometrium, right? Endometrium is growing. It's the in part of the body. So in that period of time, before ovulation, after period, we use tonifying herb during that period of time. The purpose is to tonify the endometrium. And after ovulation, because of the progesterone goes up, and it's the young part of the body. So in that period of time, after ovulation, we use yang tonifying herb.
So the characteristics of yin herbs is that they're maybe more cool sometimes, they are more nourishing, they are more heavy, and then yang tonifying herbs are a little bit more warm, a little bit more moving.
Yes, that's right. So the yin tonifying herb is nourishing yin. So the blood will become more blood in the body. It's tonified blood and tonified yin. And when you use yang tonifying herb, you're tonifying the function, and you're tonifying the temperature, you're tonifying the heat. We cannot say the heat, the thermal function of the body.
Sure. Yes.
That's right.
Because I think a lot of my patients in Ireland and in Europe, they are surprised that the treatment will change at different parts of the cycle. But of course, people present very differently, premenstrually, during the bleed, after the bleed, and also during ovulation. Sometimes it's possible for symptoms to occur then.
After ovulation, the symptoms.
At ovulation. Sometimes women will have discharge, or they will have headaches, or they can have some.
After ovulation.
Or during.
During ovulation, yes, ovulation symptoms. Yes, that's right. Ovulation symptoms, the most commonly seen symptom is little bleeding. Little bleeding during ovulation. So that's it's a abnormal bleeding. We call it dysfunctional uterine bleeding, because during that period of time, if a woman have unstable endometrium, so she will have ovulation bleeding. And during that period of time, they maybe have more discharge and like waist soreness, waist pain, and abdominal pain, or headache, you say. Yes, several symptoms during that period of time.
So menstrual health is not just about the bleed. it is also about the whole cycle.
The whole cycle. Yes, that's right.
I remember one of my teachers told me that women are very lucky to have a menstrual cycle because it gives a lot of information about the status of their body, and men don't have anything like this. So, what kind of things do women in Taiwan do to maintain menstrual health?
Actually, if they have no symptoms, Taiwanese women sometimes they will have 四物汤. They have a formula to tonify the blood after period. After the end of the period, they will take 四物汤 for 2 days, 3 days to keep the blood sufficient.
Just as a tonic, just to replenish and build themselves up.
Yes, that's right. And before period or during period, they will take 生化汤 to expel the blood smoothly. So they will feel less uncomfortable during the period. Yes.
And will they do this even if they don't have symptoms?
Yes, that's right. We just keep the body health, keep the health of the body, and they will have healthy period, healthy cycles.
Because in the West we take supplements. You know, I think right now for period pain, a lot of women take things like magnesium or, you know, ashwagandha or things like this. But the formulas that Taiwanese women are taking have been used for hundreds of years, and you know, take different formulas at different parts of the cycle, and I think it's very effective.
Yes, they use this for hundreds of times, hundreds of years, and it's from our ancient age. Yes.
And then what about other kind of behavioral things, lifestyle things? Do they have other practices they do to maintain a healthy cycle?
Yes, that's right. Behavior is also important for keep a healthy cycle, because in Taiwanese women, usually they don't take iced thin or cold food before period and during period, because iced drink, iced beverage, and cold food will cause pain more severe. If patient have painful period, they will stop to taking this kind of food during that period of time.
Because we have this concept in Chinese medicine that cold constricts. It causes things to tighten up and get smaller. And obviously, coming up to your period, you want things flowing gently. I mean, we have a very famous formula called Wenjing Tang.
Yes, that's right.
Warm the menstrual flow.
Yeah.
You know, to warm everything and get it flowing smoothly. So obviously, cold drinks, ice is not a good idea at that time of your cycle.
That's not a good idea. The cold food, cold drinks, they will make the vessels or the muscles contract. When they contract, the vessels contract and the muscle contract, they will make the painful period, and the expelling of the blood cannot go smoothly. They will stagnate. So that's why we ask patients don't take ice before period and during period.
And what about things like exercise? Do you have any thoughts on exercise during your cycle?
Exercise is good for to warm the body, to make the blood go smoothly. So during the cycle, it's good to take exercise. But when patient have endometriosis, we don't ask patient to do exercise during period. Endometriosis is an exception.
Okay, that's interesting. There is a lot of attention now on endometriosis.
Yes, that's right.
I think all over the world. Is it something you see frequently in your clinic?
Endometriosis patient, lots of women have endometriosis nowadays. I don't know why. Yes, in my clinic, lots of patients come to me to treat their endometriosis. A lot of women like that. Yes, they have like heavy bleeding, painful period. Some of them have painful abdomen. Even though the period has ended, during the whole month, they have painful feeling in their body.
Yes, it's a very. Would you agree that it's a difficult a difficult disease to treat?
Yes, it's a difficult disease, not easy.
No, but I know personally I've had some good results with Chinese herbal medicine in my clinic treating endometriosis. How about you, Dr. Su?
Yes, some of them have good results. But the disease is difficult, but symptoms are not difficult.
Right.
We control the symptoms using Chinese medicine, but if you want to cure the disease, it's very difficult. So the symptom we treat like pain, we treat the pain during period or the pain during the month, and we also treat heavy menstruation, heavy bleeding, and when we treat heavy bleeding, we avoid the patient go into the condition of anemia. So the patient they don't need to receive blood transfusion 3 months or every month. They just take Chinese medicine. They will keep the blood inside the body. They don't lose their blood a lot.
That's fantastic, because I know so many women that are anemic or low iron, and their options in the West are to take liquid iron or iron tablets.
Yes.
And very hard on the digestion.
Oh. Yes.
Because so many people that present with anemia, or what we might call blood deficiency, they also have digestive issues.
Yes.
So then trying to give the iron tablets is very difficult, but Chinese medicine has an alternative.
Yes, that's right. For a patient who have endometriosis, because the anemia comes from heavy bleeding, so if we prevent the loss of blood, we treat heavy bleeding, we can prevent anemia. So we can prevent patient taking the iron. Yes, so if the patient control their blood quite well, they don't need to take iron.
And how about if somebody is already anemic? Can Chinese herbal medicine still be useful?
Yes, a little bit. But Chinese medicine, some of the Chinese medicine, they contain iron in the herb, like Di Huang. Di Huang have lots of iron. So if patient have anemia, we will prescribe Di Huang to the patients, lots of Di Huang. So they take Di Huang. Of course, they need to take more meat. More meat or seaweed. Seaweed have lots of iron. Meat have lots of iron. They need to take iron from the food and from Chinese medicine.
So this is very interesting to me, that Chinese medicine very strongly encourages women to eat meat. Would you agree with this, Dr. Su?
It depends. If patient need blood, patient have anemia, I will ask patient to take meat. But if patient take too much meat, they have lots of body weight, I will ask them to stop to take meat.
Sure.
Yeah, to keep balance, keep neutral.
Okay, because right now a lot of people are more interested in vegetarianism and veganism in Europe. What are your thoughts on this, Dr. Su?
If vegetarian, if you are vegetarian, you need to pay attention to the nutrition more than patients who are not vegetarian. Because the vegetarian, they usually their body are deficient of like vitamin B12 or vitamin D. It might be the calcium and iron. So if you are a vegetarian, you need to take more food, have these 4 kinds of nutritions, especially vitamin B12. It's very less, almost none in plants.
Yes. And then of course when we talk about gynecological health and menstrual health, this leads into fertility.
Yes,
as
that's
well,
right.
And obviously more and more people are using Chinese medicine for fertility, acupuncture either alone or in combination with IVF, and Chinese herbal medicine. So how can Chinese medicine help with fertility?
Chinese medicine, the first, if you keep the period health, the menstruation healthy menstruation, they will have higher possibility to get pregnant. So the first thing, if patient want to get pregnant naturally, you need to create a healthy, normal cycle for patient. So you adjust the patient's cycle, you tonify the qi and blood to make the cycle health, make the menstruation health. So you help the fertility for patient. And if the patient want to have IVF, so you need to help the successful rate of IVF. So you need to follow their cycle, follow their treatment for in IVF course.
Is there a danger that Chinese medicine can interfere with the IVF treatment?
Yes, that's right. If you don't know patient is going into IVF course and you prescribe the wrong Chinese medicine, it will interfere the effect, the result of IVF. But if you know what the course the patient take, if long course or what the Western medicine drug they are doing, they are taking, they are undergoing, you can help them using Chinese medicine. You just use Chinese medicine to when they are doing the course. For example, before the ovum pick up, they use some herb who can nutrient the follicle or the eggs.
Okay.
Yes, how to say that?
Yeah, they can nourish the follicle and lead to better egg quality.
Yes, that's right. Some of the herb they increase the quality of eggs. So when they do ovum pickup, and they would have a good quality of eggs. And after that, when they do implantation, you need to increase the quality, increase the healthy of the endometrium. Endometrium, if you have a good endometrium, the endometrium have good glands and good vessels, and the implantation will be more successful.
Okay.
So during period of time, you know what they want to do, you just prepare for the next step treatment of Western medicine.
Because I think a lot of people think there is some conflict between Chinese medicine and Western medicine, but actually I think it is more about we are speaking different languages, but we are describing the same thing.
Yes, that's right. When patients are doing their IVF course, I think Chinese medicine is helping them to get a higher successful rate, higher implantation successful rate. Yes, I think Chinese medicine are helping. It's not conflict.
No,
not at all.
But you need to understand. We need to talk to each other and understand what each is trying to do.
Yes, that's right.
I would like to talk to you now about the sitting month.
Sitting month.
Which is a very uniquely Asian practice. So for those that don't know, after giving birth in places like Taiwan, the new mother will rest for a full month. And the sitting month has three aspects to it. It has formulas, food therapy, and certain behaviors that are considered beneficial. I know you've done some research as well into this practice. Can you tell us a little bit about the 坐月子 and about your research, please, Dr. Su?
Okay. 坐月子 is an ancient custom. I think it's a custom from China. And the purpose of 坐月子 is to recovering the body. Because after childbirth, the new mothers will have many symptoms like pelvic pain or fatigue, and they need to feed their baby. They will have lots of uncomfortables. And 坐月子, the purpose of 坐月子 is to help the mother recover their body and treat all these uncomfortable things. And after 1 month, they will become a new person, like original before pregnant. They will recover their body like that before pregnant condition. So that's the main purpose of 坐月子. So therefore, lots of things they need to do to recover their body. Like you say, formulas and staying at home and like meat, diet, special diet during the period of 坐月子, the 1 month.
I mean, it makes complete sense that a woman will need a little bit of help recovering after something, after a big event like childbirth. And I know that, like when you were treating different parts of the menstrual cycle with different herbal formulas, there are different herbal formulas to be taken after childbirth.
Yes, different formulas are taken after childbirth. Usually, this depends on the purpose. After childbirth, usually the first 1 week after childbirth, the purpose for the mother, and they need to expel the lochia. So the first formula is the formula of 生化汤, and 生化汤 will help to expel the lochia. So 生化汤 is a formula to activate the blood. To activate the blood will help the expelling of the lochia. That's the first formula. And then the second week and the third week, we will tonify qi and blood. Like we will take 四物汤, we will take 四神汤. The second and the third weeks, we're doing that kind of thing. And on the fourth week, the last part of during the month, we will take herb to tonify qi and blood. Besides, we will take more to tonify the kidney. We will tonify the kidney to recover the bones and the muscles. We will tonify the kidney qi. After we do that, the body to make the muscle skeletal, the bones and the muscles will recover, become more healthier, and it will get rid of like waist pain, body pain, headache, this kind of thing. And so we have several formulas in a sequence. The first is to activate the blood, tonify qi and blood and the kidney, and the last one we tonify qi and blood and kidney more. So a sequence, several formula we use.
It makes a lot of sense because again, in the West, a lot of what women get is, you know, maybe even they get a blood transfusion depending on how the labour has gone. But I find it very interesting that the 4 formulas, they begin by clearing even more. You know?
Yes, that's right.
And then we gently tonify qi, we tonify blood, and then the last formula, would you be talking about things like Sichuan Dabu Tang?
Yes, Su Shan Yu, yes,
so
that's right.
At that stage, we are now introducing some herbs that tonify a little bit of kidney yang.
Yes.
So, like you said, the musculoskeletal system, so it's time for them to get out of bed. And I think probably the reason this works is because of the behavioural side of the Zuozuizi, apologies, where, you know, historically the mother did no housework, no cleaning, no cooking, just stayed in bed.
Yes, during that period of time, actually the mother is quite busy because they are doing like baby, feed the baby,
of course,
watch the baby.
Yeah.
Yes, they are taking of the baby. So I think they are quite busy, and they need to take a rest to recover themselves. So during that period of time, traditionally, the family will help the mother to help the mother to take care of the baby, and to help the mother, let the mother take a rest, so recover the body. We have a very good family system and community system to do that. So during that month, the mother don't need to do any work, domestic work, or they don't need to going out to buy things, going out, do anything. They don't need to do anything. They just stay at home and take care of the baby.
And I think that's important because the first formula is more clearing, and if you were trying to work and take care of the baby and clear out, you know, the rest of to do this kind of clearing as well, I think you would get very, very tired.
Yeah, very tired. Yes, I think so. Yeah.
So it's about everything working together.
Yes, that's right.
And have you noticed a difference between women who do the sitting month and women who do not do the sitting month?
Yes, that's right. We have a research of that. Like the research is that we compare the mothers. They follow the during the month behavior, or they follow the formulas, and the mothers, they do not follow the formulas and they do not follow the custom. We compare these two groups, and we find if the mother they take more Chinese medicine during the month period, they will have a better uterine evolution. Their uterus will recover better than the monks who do not follow the custom. That's our research. We have the conclusion of that.
And that's extraordinary because that's very measurable. Like
Yeah.
I've seen your paper, you were looking at the shape and the size of the uterus under ultrasound.
Yes, that's
And there was
right.
a big difference between the patients that took Chinese herbal medicine.
Yes, that's right.
It returned to its pre-birth size much more quickly.
Yes, that's right. In our research, we have found that when the mothers taking Chinese medicine more, their uterus will become smaller than the mothers who do not take Chinese medicine. So the Chinese medicine, it does help mother to recover their uterus.
And I know you've done some work on depression, postpartum depression as well,
Yes.
which is another very big topic in Europe at the moment because I think it affects a lot more women than we understand. You know.
Oh, lots of women. Yes, after childbirth they have depression. Yes, that is right.
And what have you found in your research, Dr. Su?
We found in traditional Taiwanese doing the monks custom, we have lots of behavior restrictions. You know that, like the mothers cannot take a bath, the mother cannot wash their hair, the mother cannot go out, and the mother cannot expose themselves to the wind, the draft, and the mother cannot squat, cannot carry heavy objects. Lots of behavior restrictions in doing the monks the custom. And we have done the study, the research. We found that some of the behavior restrictions they did help the mother. They are good for the mental health, such as if you don't let the mother restrict them to squat, they restrict them to carry a heavy object. It's negatively correlated with the depression and anxiety scores.
So the anxiety and depression is less.
Yes, that if they follow the custom, they don't squat, they don't carry heavy objects, they will not have more depression, they will not have anxiety, and they have better sleep quality. Some of the behavior really help.
I think there was quite a big difference as
Yes,
well. Yeah.
that's right. Yes.
Great. Well, I think there is a lot we in Europe can learn from the way pregnant and post-delivery women are treated in Taiwan. So thank you so much for talking to me, Dr. Su, and for sharing your knowledge.
Thank you.